What is BPC-157? It's a peptide. And what is a peptide? Peptides are small proteins, naturally occurring short chains of amino acids that we find in the human body. Insulin is an example of a peptide, and they all work as tools to instigate specific effects within the body's system. They do their jobs very quickly and then disappear, meaning they have very short windows to work before they are entirely removed from the body. And so, for this, peptides are generally considered safe compared to other drugs or compounds that might take a lot longer to clear from the system. And in that longer time, they possess a much higher chance of doing something that we don't want to happen, or building up to levels that may cause a problem. So, peptides like BPC-157 have half-lives of between 2 and 30 minutes, whereas testosterone enanthate has a half-life of 4.5 days. A possible positive of longer half-lives, which is why testosterone enanthate is popular, is that you are not required to inject the drug as frequently. However, that gives testosterone much more opportunity to do things like aromatize into estrogen, and does not mimic the more frequent normal release of testosterone. As we already said, peptides exist naturally in the body, in very large amounts in young people, and then the amounts decline as a person ages during their lives, which may explain why as you get older the risk of injuries and damage and reduced repair of these become more of an issue. BPC-157 is not approved by the FDA, which is generally considered to be the gold standard of good drugs, which is a very debatable subject, but it means importantly that you cannot easily get a hold of BPC-157 legally for human use, although through some clinics you can get doctors to prescribe it experimentally. But a lot of doctors do seem to be encouraging its use, and it's also on the WADA prohibited substance list, which is generally a good indication that a substance has some sort of performance-enhancing effect. So what does BPC-157 do? The BPC part stands for Body Protective Compound, which should give a rough idea of its function. In general, it works to repair damage to the system, including things like bowel disorders, stomach ulcers, as well as damage to the musculoskeletal system, so injuries to muscles, tendons, connective tissue, nerves, and bones. Which is where the main attraction comes in for arm wrestling and sports in general, where damage to these tissues are very common, both acute and chronic. Tendons in sports, especially in arm wrestling, are prone to damage due to the extreme loading they undergo, making tendinitis and tendinopathy very, very common. And these tissues, because of their very reduced blood supply in how they are built, heal very slowly, with tendinitis taking anywhere from weeks to months to begin to diminish. And this is where BPC-157 shines. It has been shown many times to drastically reduce healing times to injuries, essentially by signaling the body to do more of that healing work at a faster rate and increasing the growth of new blood vessels which supply these body parts with the nutrition to heal and grow. And it seems to do this much faster than things like PRP or stem cell injections, which are both much more expensive. Especially useful for arm wrestlers is that the tissue targeted by this includes bones, meaning bone fractures or breakings may improve much faster, and the bones themselves may develop greater density, protecting them from breaking. The liver is targeted too, which is often an organ of issue with athletes, especially those using other PEDs or with alcohol consumption, which can be very toxic and destructive to the liver, while BPC-157 may help the organ regenerate from its damage and improve the function of it. It also brings strong anti-inflammatory effects and seems to possibly reduce the activity of pain receptors in the body, which again, with arm wrestling in particular, may do a very good job of reducing the aches and pains that go hand in hand with the sport, which means that an athlete can train more without pain hindering them quite as much. Not directly related to sports, but certainly useful, is the improved digestion that BPC-157 seems to bring, as well as reducing symptoms of digestive issues like inflammatory bowel syndrome. One field that is gaining more analysis around PEDs is the neuroprotective effects, which just means that the drug works to bolster and aid the mechanisms and strategies the body employs to defend the central nervous system and brain against injuries, like acute trauma or stroke, as well as more chronic issues like dementia, Alzheimer's, epilepsy, and many others. BPC seems to work in this area by increasing the production of antioxidants in the body, helping to reduce oxidative stress, which can be brought about through diet and lifestyle as well as through normal aging, and leads to quite high damage and degradation to the brain due to its high metabolic turnover activity. More specifically useful to athletes is another neuroprotective impact BPC-157 seems to offer, which is the promotion of new neuron growth. Neurons being the messengers through which the CNS sends signals to different parts of the body to carry out actions. These are the things that essentially allow you to learn things, especially physical movements. And having more of them means you may learn faster, and having more neurons being sent through neural pathways means the pathway widens and allows more neurons to flow, and to flow faster, which essentially means that the strength will increase regardless of muscle and tendon hypertrophy, because the body becomes that much more efficient at doing what it is told to do. In addition, reaction time will improve, both through a higher bandwidth through which the data travels, and the improved learning from each repetition, switching the movements from the relatively slow conscious movements more and more into the more rapid automatic subconscious movements. Finally, BPC-157 also seems to improve cardiovascular functions by reducing inflammation and improving blood flow, which means the muscles and tendons involved have a much more available supply of blood and oxygen to fuel and repair the tissue. While all of these sound quite wonderful, it's important to remember that BPC-157 is still very new and has limited research on any potential negative effects. The drug has not been in existence or use for long enough for the longer-term effects, both positive and negative, to be fully analysed, so there is still a phantom of unknown potential impacts lingering. Allergic reactions are very possible with all peptides. Other medication that a person takes may interfere with or be interfered with by BPC-157, and there is not really a defined map of what does or does not work harmoniously or not with the drug, so you may run into unexpected, potentially catastrophic effects with other medicine, both pharmaceutical or not. And a big one, like many other drugs that promote growth, BPC-157 may bring an increased risk of cancer. On the other hand, there are studies done that found no significant association between BPC-157 and cancer risk, and one study done on mice found that the peptide may actually have anti-tumor effects in some cases. So while these risks are possible, the reality of them is hard to define, and clearly much more human studies are required, but given the potential positive uses, this seems very likely to happen. Overall, BPC-157 seems very possibly like a useful drug to have available, especially for athletes. It could help training and recovery, as well as recovery from injuries and general well-being. But being so untapped and experimental, there's still an awful lot we don't know about at all. So if you do try this, be very careful and if possible get medical help alongside, if not as the actual prescriber in the first place. And that's it. Do you have any personal anecdotal stories about BPC-157 that you could share in the comments for anybody curious about the peptide? The majority of public perception seems to be positive, but you do sometimes hear about some outliers when you listen to actual people's stories.